Good evening, my people. Today is yet another day whereby we are continuing with our online education as we have been all the way through. And before I start the topic of the day, I do appreciate you people for the support. I do appreciate for the subscriptions, the likes, and the comments you are giving. This is taking our videos to a greater height. So, for those who have not subscribed, let's continue subscribing, liking, and sharing our videos so that they may reach as many people as possible. So, today we are going to talk about what we call sexually transmitted diseases. Let's differentiate between STIs or sexually transmitted infections with Std'S or sexually transmitted diseases. That means STIs versus Std'S. Most people are often confused between sexually transmitted infections or STIs and sexually transmitted diseases. These two are actually different. An infection in which is when bacteria, virus, or parasites attack the body comes before a disease. Infection comes before a disease when a parasite, which is virus or bacteria, attacks the body. An infection can result in zero symptoms. An infection can result in zero symptoms. That means an infection may have no symptoms. And disease which usually always comes with clear signs. Infection can result in zero symptoms, whereby a disease you always comes with clear signs and symptoms. Note this: a sexually transmitted disease will always start with a sexually transmitted infection. That means before you get a disease, you must have an infection. But not all sexually transmitted infections turn into sexually transmitted diseases. What are the signs and symptoms of sexually transmitted diseases? And I hope some months back we discussed about syphilis as a sexually transmitted disease, and we also tackled in deep about sexually transmitted infections. So for those who went through my videos, I know you know what we are talking about. So what are the signs of sexually transmitted diseases in general? A sexually transmitted disease starts with a symptomatic sexually transmitted infection. A sexually transmitted disease starts with a symptomatic sexually transmitted infection. For example, number one, pain or discomfort during sexual intercourse or during urination. Number two, sores, bumps or rashes on or around the vagina, penis, testicles, anus, buttocks, thighs, or mouth. Number three, unusual discharge or bleeding from the penis or the vagina. Number four, painful or swollen testicles. Number five, itchiness or itchiness in all around the vagina. Next point, unexpected periods or bleeding in between menstrual cycle. Unexpected periods or bleeding after sexual activity. Note this, not all sexually transmitted infections have symptoms. Other symptoms can be quite different and depend on the STD or the sexually transmitted disease and include the following. This is very important. Not all sexually transmitted infections have symptoms. Some of them may be asymptomatic or may have no symptoms. Other symptoms can be quite different and depend on the type of sexually transmitted disease you are having and include fever or high body temperatures, recurring pain. This may be low abdominal pain, or pain during sexual intercourse, or pain during urination, fatigue or feeling of tiredness, memory loss, changes to vision and hearing. You may be having problem in eyesight or hearing sight. Then we have what we call nausea or feeling of vomiting, weight loss, lumps or swelling. What are the underlying sexually transmitted disease causes? What are the underlying sexually transmitted diseases causes? All sexually transmitted diseases are caused by sexually transmitted infections and transmitted, or the mode of transmission is through contact, including through body fluids or skin or contact via vaginal, oral and anal sex. Note this, some of these sexually transmitted diseases, never become a disease, and if they are treated earlier enough or diagnosed and treated on time, go away by themselves. This marks the end of our first video about sexually transmitted diseases, and let's meet in the next video whereby we are going to discuss about the same disease, and I hope you guys are going to enjoy and learn from our discussions. Let's continue subscribing, sharing and commenting on our videos. Let's meet in the next video.